Welcome to Take on Tech, your weekly guide to the innovations, trends, and big ideas shaping Kenya's digital future. In today's episode, our main story takes a deep dive into how access to healthcare is being transformed in Kenya and beyond through digital platforms. But before that, let's bring you up to speed with the latest tech stories making headlines this week. TikTok gives Kenyan musicians new tools to grow a global audience. Kenyan musicians now have a new way to showcase their craft to the world thanks to TikTok's latest platform, TikTok for Artists Kenya. This data-driven tool allows artists to access real-time insights on their music, followers, and post-performance all in one place. From understanding audience demographics such as gender, age, and language, to measuring how fans engage with their content, musicians can now tailor their strategies with precision. The platform also tracks song performance metrics, including creator engagement and usage across TikTok, offering Kenyan artists the visibility they need to compete on the global stage. With music increasingly consumed digitally, this move could redefine how Kenyan's talents connect with international audiences. More than 120 young people in Kisii County have successfully graduated from Huawei's DigiTrack training program, a 4-week initiative designed to bridge Kenya's digital divide. The DigiTrack is a solar-powered mobile classroom that has already empowered over 6,200 youth in 39 counties. Participants gain hands-on training in computer use, internet access, digital marketing, online safety, and even entrepreneurship. For many rural communities where digital resources are scarce, this program represents a lifeline. Beyond personal growth, the skills acquired align with Kenya's Digital Superhighway initiative and the bottom-up economic transformation agenda better, ensuring that no one is left behind in the country's march toward a tech-driven economy. Education's Ministry official Joseph Njau praised the effort, saying it aligns perfectly with Kenya's bottom-up economic transformation agenda, specifically the digital skills superhighway.
We are not training for the local market only, but we are training for the HOTS. We are training for the international market, and that is why these digital skills are very key, because you know that the world has gone digital. Even when it comes to commerce, you're talking about e-commerce. Everything, we are talking about artificial intelligence and so on and so forth. And we do not want to be left behind as a country. And that is why we as the government, we are going to do all that it takes to ensure that every Kenyan is going to be part and parcel of this digital superhighway, to ensure that we are going to participate positively in the e-commerce in the entire world, and also in research, in innovation, and in general development when it comes to the e-commerce.
We appreciate that opportunity, and as you can see, we are right deep in the middle of Kisii, just bordering Kilgoris. So that means that the training is actually really reaching the grassroots, and we want to encourage the team to do even more of those, because digital training, as I said, is very important. We can have our young people have opportunities for employment even via the digital market space, and also very importantly that they are being taught on online safety, which is something that has become very private right now in the community. So very thankful to the team, and we want to encourage Huawei Kenya, together with all the other partners, to continue with that very noble cause that they are doing. This can really assist the Gusii region, because Gusii region is 80% agricultural. Most young people are not very prone to agriculture, but we also have a lot of our elders, our mothers, our parents doing agriculture. And the fact that they've been taught digital market, I think it's very powerful to connect the outside world to the Kisii market, because we do have a lot of farm produce that most of the time we are only selling at the transition highway areas. But these young people can actually use this skill through the digital marketing space to connect these farmers directly to to the demand that is out there. Like, for example, we have very good vegetables, which grows super well in the Kisii region. And very many people want access to this. So why not have the young person connect with the elderly woman, and enable them to be able to sell this produce to the outside world, and also even them to earn a commission from it.
The DJ truck we started from 2019, and so far we trained over 36 counties in Kenya, trained more than 9,000 students in Kenya. The reason why I started Digital Initiative is because we see that the digital literacy is very important in Kenya, especially we see the digital gap between the rural area and the city. So that's why we launched this Digital Initiative. We bring digital knowledge technologies to the rural areas to train the students the basic technologies, basic 5G, AI technologies, and we want the students to use these technologies to make it into daily use. Like you can use the digital marketing knowledge to benefit your selling, like to sell your products to the market and promote it to the international market.
This is tech for the people, by the people. Indian software giant Zoho is positioning Kenya at the heart of its AI expansion in Africa. Its in-house AI assistant, Zia, which has been evolving over 13 years now, integrates large language models, LLMs, to deliver smarter, context-aware enterprise solutions. Unlike many global AI platforms that depend solely on generic datasets, Zoho is leveraging Kenyan customer data to train its tools, ensuring greater relevance for local industries. Early adopters include insurance providers, IT hardware companies, consultancies, and fintech firms, all reporting improved customer engagement, predictive analytics, and efficiency. With Kenya serving as Zoho's East African hub, the country is becoming a proving ground for how AI can be localized to uniquely solve African business challenges. Imagine accessing your doctor right from your phone, anytime, anywhere. Not just that, but also your lab and pharmacy services, all while your data is being protected. This has been made possible by Klinik Telehealth, who have brought healing right to your doorstep, just a phone or a chat away. They have revolutionized the healthcare system, making it more accessible, especially for the underserved communities. We have the whole story right here. Before we dive into today's main story, let's take a quick look at how technology is reshaping the future of healthcare, not just in Kenya, but globally.
What does it look like to reimagine the possible and change the way that we think about healthcare technology? It looks like the future. A future where we can conduct clinical trials and develop new therapies from anywhere, so we can deliver the right care everywhere. And where physicians and patients are empowered to make more confident decisions with technology that leads to smarter outcomes. It's a future that facilitates innovation and collaboration on an unprecedented scale and orchestrates people, insights, and technology to redefine what's possible as we turn our new ordinary into the extraordinary. The future of healthcare is now. Let's explore it together.
Healthcare access has always been a challenge across much of Sub-Saharan Africa. Long distances, high costs, and limited medical infrastructure stand in the way of millions who need care. But now, a homegrown solution is changing the game. Meet Klinik Telehealth, a digital health platform founded by Steve Dimba with a bold mission to make affordable, reliable, and quality healthcare accessible to all. Klinik operates like a virtual hospital, bringing together services that are often fragmented: virtual consultations, lab testing, prescription delivery, and even ambulance services into a single user-friendly app.
So Klinik Telehealth prides itself in two core products. So we have what we call Afya Chat, which is a WhatsApp chatbot that we've developed to ensure that our young people, majorly focused on the young youth and young adults who are normally on their phone now and then, they can be able to access doctor services. That means professional doctor consultation, pharmacy services. That means you can be able to buy over-the-counter drugs through our platform. You have a prescription, you can upload onto the platform, and our partner pharmacies will be able to fulfill that. You can also be able to access mental health and the therapy services virtually. And lastly, what we're building now is an ambulance services for emergency services, because people do not know most ambulance numbers offhand. But if they have used our platform, it's easy for them to get to ambulance numbers. So that's what we call the Afya Chat. We also have another product called the Afya Call. So this is where you call our number and we automatically connect to your service provider, whether it's a doctor. That's the same way the chat does. The only difference is the medium here. So here on the Afya Call, you're calling our phone number. It's 020 790 3970. So when you call that, we've built what we call a virtual call center. So the system will just call in the way you can be able to call a consultant. Say press 1 to consult a doctor, press 2, just the same way. So you navigate easily and you can be able to connect you to a service provider. Yeah, so we've done a lot of what we call get processes, or just ensuring that from a quality perspective, things are right. First, all our partners are certified by the respective board that mandates them to do what they do. So if it's a doctor, is certified by Kenya Medical Professional Dentist Council to be able to offer telehealth or telemedicine. So here you're talking to a doctor who is board certified. Once you've interacted with them, whether via chat or via voice call, they can be able to do a prescription. And the prescription will be sent to you via your WhatsApp or your email if you wish so. So that means you're getting a prescription that has a doctor's certified number that you can validate. If you want to use our pharmacy platform, we only onboard certified pharmacists and pharmacists. So that means we have a team on the ground that go physically to validate that pharmacy and be able to check all the requisite documentation. We check with Pharmacy and Poison Board to validate before we onboard you into the platform. So we've taken through a lot of seriousness in terms of credibility and in terms of service provision, just to ensure that the service that you receive is top-notch. It's equivalent to walking to a physical facility. The impact is massive. If you look at WHO patient-to-doctor ratio, in Kenya we are much worse. We are like 1 to 16,000 patient-to-doctor ratio. So that means there are a couple of barriers that makes people don't go to a health facility. Waiting time, distance, cost, all those factors. So what Klinik does through our product is we've created a direct through. In the essence that if you are out of town, Nairobi for instance, you've traveled out of town, you can still consult a specialist or a general practitioner that is certified that you're comfortable with. So that is number one. So the people who are living in peri-urban or rural areas, these services come in handy because it means every mobile phone is an access to a healthcare facility or a healthcare or a wellness center. So remember, I said we got two modules of access. There is the Afya Chat, which is a WhatsApp-based, and then there is Afya Call, which we just call the number, and our automatic call center will be able to guide you and connect you to a doctor. So we've broken that barrier. So we don't, where you are, whether you have an internet access or not, our service is still accessible. That means they are helping us on the low end of the pyramid, people who do not have internet access. So us in the private sector, we are playing in an area where our sweet spot, people already have smartphones, people already used to calling. So that means accepting our services will not be a challenge. To build trust, that's why we go to our next end to ensure that the service that you receive on our platform is top-notch. And we have created a very elaborate feedback loop that after the service, you'll be able to give us your feedback so that we can be able to analyze and get back to our partners. If there's something that needs to be corrected, our partners will be able to correct. So somebody said convenience has 3 attributes. It needs to be simple, it needs to be cost-effective, and it needs to be serve a particular utility. Now, in terms of cost, telemedicine is normally 40% cheaper than the conventional aspect because our overheads are less. We are connected directly to a doctor who already is in practice. So, but basically what it's doing, the system is adding more foot traffic to this doctor's doorstep than individually they could. So that means that aspect of you moving from point A to B, that cost that you will have incurred is saved by the infrastructure. So because of that, now you find that we have provided convenience, but in terms of operating cost is less, so you're enjoying that particular saving on your end. So you end up paying like 40% less if you walk into a physical facility.
That's just how fast technology is moving, and it is clearly disrupting the health sector. We have seen counties like Murang'a County embracing telehealth. What do you think about this particular technology? Klinik, talk to us at KBC Channel 1. The hashtag is Take on Tech. My name is Stephanie. I will see you next week, same time, same place. Remember, tech starts here.